Welcome to Candid Conversations with Dr. Mayfield. This episode is sponsored by Mayfield Counseling Centers, helping you find clarity, hope, and purpose. Call us at 719-452-4803. Here's your host, Trevor Sherry.
Welcome to today's episode of Candid Conversations with Dr. Mayfield. We have the unique honor of having Mrs. Sarah Mayfield join us today, who is Dr. Mayfield's wife, but also the co-founder of Mayfield Counseling Centers and the director of hospitality here at Mayfield Counseling Centers. Sarah, thanks for joining us today.
Thanks for having me.
Now, we invited you into this conversation not only because you're Dr. Mayfield's wife, but also because you have a very unique story of cancer at a young age.
Yeah, I had cancer. Starting at age 5, I was diagnosed with leukemia.
About what that was like. I'm sure cancer in general is horrifying, but especially at such a young age.
It became my normal, in a sense, if you can find normal inside of having cancer. I had treatment for 4.5 years, so it really became my childhood. Instead of, I did play soccer for a short time, but it was, instead of, like having a normal, like every weekend is a soccer game, It was every weekend was going to the hospital for testing. So we formed our normal inside of what a family dealing with cancer, what that looks like. And so we did our best. I have 2 sisters, and my parents were rocks through all of that. But we formed our normal. We had what our family did.
And for those of our listeners, and I would include myself in this as well, who have been fortunate enough not to be affected by cancer in ourselves or in those close to us, can you briefly describe just a little bit of what cancer does to the body and what that experience for 4.5 years is, so we have a better idea of what it was like being 5 with cancer?
It kind of became an identity. I was the kid with cancer. You knew when we walked in the doors wherever we went that we were the family that had a kid with cancer. And we spent a lot of time in the hospital. That became a place that I knew really well. I was definitely pretty feisty, though. I wasn't your average patient. I was the first one to find those big fat syringes and fill them with water and shoot the doctors and the nurses. But it changed our family dynamics. When one person becomes the center of the family, it changes how your family works.
Yeah. And
as much as we tried our best to create, I keep using the word normal, but it was to find a place for everyone in the family inside of that time. And it brought a lot of pain. It brought a lot of opportunities to see God move in a way that we wouldn't have seen had we not gone through that.
You talk, and when we talk, you talk a lot about the fact that you were a resilient kid, you were tough, you were, a fighter and that kind of thing, which is part of the reason you're sitting here today. However, as you look back on that experience, like what were you really going through? What were you feeling? What kind of things do you think parents should know about, with a kid that maybe is struggling with chronic illness or cancer?
Kids definitely come up with their own narrative of what's happening. And mine was that I was the least valuable person in my family. That's the viewpoint from which I functioned. And it made sense to me that since I was the least valuable, that I should be the one having to deal with the pain and the trauma of cancer, because my mom couldn't have cancer. She's mom. Dad couldn't do it. He's the head of the family. My older sister is my perfect older sister and can't do anything wrong. And then we have the baby of the family. So that obviously, for a 5-year-old's mind, that left me. I was the one that was fluid, I guess you could say. That was my own self-talk. That was never, ever communicated to me by anybody else. Not by the doctors, not by my parents, definitely not by my sisters. That was just something inside of a 5-year-old's mind. that's the self-talk and the way of thinking that made sense to me.
So, I mean, it sounds like, if we have, families that are listening and that kind of stuff, that they have a kid that is struggling through this cancer or chronic illness, what I'm hearing you say is, as parents, don't assume that just because they are, visibly doing okay, smile on their face, they're trying to be normal, don't assume that everything's okay. Like, what would you say to a parent that's going through this right now with a kid? How do you make sure that doesn't become their narrative, or can you?
I definitely think if you ask lots of questions, let the child lead the conversation. And I don't think there's any way that my parents could have known what I was thinking. We had a conversation probably 2 years ago, and my parents were floored when I told them that's what I thought as a kid. And we were just doing our best to make it through what was a really difficult time. And I believed that it was my job and my role to be the person that was strong, even though I was being poked and prodded and test after test after test. It was my job to not make my mom cry, to make sure that my sisters were okay. Even though my older sister used to stand in the hall and listen to me scream and would cry for me, we each dealt with it in our own way, and there's no way to know exactly what your child is thinking, but create an open dialogue, ask questions, ask them what they thought of that, even if it's really obvious. Like, that test hurt. We all know that it was the most painful thing that you just went through. Ask your child, how did that make you feel? That seems like a silly question, but it's not. It's ask your kids how they perceived what happened. You keep the conversation open. It's a constant flow of conversation. Well,
it sounds like it's a balance, because I know that we've talked a lot about the idea that you felt like you had to be that strong individual, and you, would agree that strength is what kept you alive. However, on the flip side, there's that space for being validated and the empathy of, this really sucks and this is really hard, and really get on the kids' level to engage them on the suckiness, for lack of a better word, of what's happening.
And it goes back to the resiliency piece. We don't want our kids to be in pain. We don't want them to go through trauma. So we want to teach them to pull yourself up by your bootstraps and do the best you can with what you've been given. But inside of that, understand that your kids get what's going on. They understand that when that doctor walks in the door, my life is gonna suck. And that anxiety kicks in every time that doctor walks in the door. You have amazing support with the staff at the hospitals. I know that I did. The nurses there are fantastic, and they create a buffer between you and the doctors. And my nurse was really good. Our doctor spoke very broken English, and so she was just a language barrier or buffer between the doctor and our family. But at the same time, she would calm me. During the time, she could tell immediately that I would go into a state of pure anxiety because I knew what was coming. And kids are really, really smart. We can't treat them like they don't know what's going to happen. I had an instance where I was getting ready for another test. I knew what was coming. And a young doctor, I don't think he was an intern. He was just brand new.
Like a Doogie Howser doctor?
Yeah. Okay.
Which is a reference to some old TV show for anybody in my generation.
Right. Sorry.
Right. Look up Doogie Howser.
He's on How I Met Your Mother. Show. What's his name? Neil Patrick Harris.
There you go.
Yeah.
But he walked in, he saw me sitting on the side of the table, and he came over and he patted my knee, and he said, "Don't worry, this isn't going to hurt." And I looked at him in the eye, and I said, "This guy is lying to me." He's straight up lying. And so I hauled back and I punched him in the face. So you've got to know that your kids know what's going on. Sure. We can't fake it with them. They can sense what's happening, and you have to give them credit for being really smart about the situation too.
Well, and not to tell a kid that if it's going to hurt, don't tell them it's not going to hurt, because that just bursts their bubble completely.
I think we're born with the ability to know that needles hurt.
Yeah, right.
There's no way around that.
I think something I'm noticing through our podcasts when we talk about parenting is it kind of feels like we're pulling away every single tool a parent has. Right. They're no longer allowed to say, because I said so.
Right.
They're not allowed to say it's going to be okay. They're not allowed to say it's not going to hurt. We're kind of leaving parents with so little to say of the normal comfort words.
Well, this is such a scary road to navigate, and I know your parents are in Texas. It would be great someday to have them on a podcast to talk about their experience from their eyes, because
from a parent's perspective,
this is a scary thing. Like the worst is happening to your child, and you want to do everything you can to keep them alive. And sometimes in that, things get missed, overlooked, because your main focus is, I want my kid to survive this.
Yeah.
And so what would be your encouragement to parents that are going through this right now, from your perspective?
From a kid, I know that my parents were there for me no matter what. I remember being in my kindergarten class and not feeling well, and just feeling emotionally defeated and physically not feeling well. And my sweet kindergarten teacher, I will never forget her, Mrs. Rodriguez, she would call my dad and she would say, "Come get this girl." And he would drop everything at work and he would come get me. He'd take me to lunch and then he'd take me home. And or he was always the sound guy when we were at church. And so I would go find him if I wasn't feeling well at church, and he'd let me lay down wherever he was at. And my mom was with me through the thick of it. My dad had to travel a lot during that time, and she was there for every single bit of it. And looking back as a parent now, I remember my perspective on situations, but knowing how hard it must have been for her to allow things that were so painful and so traumatic, but you have to tell yourself and you have to tell your child that this is for your good. I can't explain how something so painful and traumatic is going to be for your good.
Right.
But just being there for your kids, I think it's true for any type of difficult situation, just being with the person that is going through that traumatic, difficult situation, that they have someone who's sitting with them, that they don't have to do it by themselves. I went through test after test after test where I couldn't be with anybody else. I had to be by myself. And there's nothing more lonely inside of that than dealing with pain by yourself. And I think that's true for if you're dealing with any type of mental illness or your own trauma or anything that you're facing in your life, is having to go through it by yourself is the worst part of it.
Mm-hmm. So what I'm hearing you say is that for parents, like, you're figuring this out as you go along, get support, tap into maybe the resources that the hospital provides, but find a good support group, whether it be some neighbors, family, church, or even others. Because a lot of times I think what parents are afraid of and what's hard is if you find friends that are there to support you, but they've never experienced anything close to this, you might feel like a burden. You might feel like they don't get you. I know a lot of times when we're going through like a grief of the loss of a loved one, it's been 5 weeks, aren't you over it yet? Type of mentality.
Right. Yeah.
Right.
And I'm wondering if it's similar for individuals that are parents that are going through this too, going, well, your kid's getting treatment, right?
Right.
And they don't know the depth of it. So even tapping into some support groups or resources of similar situations, families can support each other that way.
Right. I was talking to a mom who, she is a really sweet lady. Her youngest son has cancer. And she said, it's really hard for me to talk to other people about it because there's no way for them to understand what it looks like for us. Unless you're going through it, there really isn't any way for you to understand what it looks like. So the best thing that you can do for someone who's struggling with that, or for families that is their life, start getting involved in their everyday life. If there are siblings involved, hey, can I watch the other kids? Do you need a meal made? It's something that is the idea of community, is wrapping yourselves around the families that need you most and providing just their basic needs, but also showing that, again, you're not alone, and that even though I don't understand your situation, that doesn't mean you have to walk by yourself in this. And
I wanted to ask a little bit about what it looked like after cancer? Because obviously you don't have cancer now, you're healthy now, which is awesome, because none of this would be happening. And I know that that's not reality for everyone, but it is reality for not enough, but for some. And so what did recovery look like? How did the family dynamic change from I'm the one who, of course, this would happen to now I no longer have cancer. Where's my place in the family?
I think that you have to figure out what it looks like with cancer, and then what does it look like without cancer, because that was what we did for so long. I think when I got my diagnosis of normal, which I think isn't funny, but it's the idea that maybe we can take a breath, because we've been anticipating the worst for so long, that how do we live without that? And I think we continued to be involved in our community. That was a big part of it. I grew up in church. I grew up not just going to church, I literally grew up in my church, that we did everything there, and that continued. So I think the idea of having a strong community that you're involved in helps with the transition. But at the same time, when you're dealing with just the family members, now that I'm an adult, we're actually talking about those things more and more. We didn't talk about it when I was younger. I don't know why. It just, we moved on. And we definitely grew up with the idea of, you just pull yourself up and you keep going. And that's what a strong person does. You don't let yourself become victim to your circumstances. But I became the middle child with all the glory that comes with being a middle child. And that was who I was inside of our family role. And the older you get, the more you figure out your personality and that kind of normalcy without cancer, I guess. I keep using the word normalcy. But
one of the things that we've talked about a lot is encouraging individuals. This is just like a mental health conversation that you and Trevor, you and I have had for a long time. Reach out for help. It's not a weakness to go, I need to go see a counselor. My kid who's going through counseling or cancer needs to go see a counselor to get that extra support, that outside support. And sometimes it's easier. I mean, and maybe in this situation too, it's a lot easier to be paying for somebody to be that support instead of burdening or feel like you're burdening family or friends, which is probably not the case for a lot of people. But I know oftentimes we feel that way when we're the ones that are always having that issue or problems, or we have this chronic thing that's happening, like a terminal illness or cancer, where we don't want to burden those people around us, because we want those people to be our joy and our laughter and that kind of stuff. So you don't
want them involved in the dirtiness.
Right. And so sometimes paying for support through counseling is the best way to go, whether it be just on a monthly basis or every couple months, just to check in and make sure. But there's something about having that confidentiality where you can close the door and just let it all out. That's really, really beneficial.
In the 1980s, that was not an option to my knowledge. You got your medical treatment, and you kept yourself alive, and parents, you kept your child alive, and you kept hoping for the best. But I think the minute that diagnosis happens, you get that kid into individual therapy, you get the family into family therapy if the parents need individual, because I can't imagine what it's like I know what it's like to be the kid, but I don't know what it's like to be the parent of the kid. And there needs to be as much support as possible to make it through, because you don't walk away from cancer unaffected. You can do your best to not become the victim. I don't believe that I walked away with that mentality, but I did walk away affected. I've been to counseling as an adult and realized things that developed in me that I didn't know developed in me. Of course, the anxiety is really obvious, but even trust issues. You don't know that those things are going to happen. eating disorders, how I manage my happiness with food. And because as a 5-year-old, that's what you get your hands on. That's what is available to you is good old hospital Jell-O. But I still don't really like hospital Jell-O. But it's the opportunity to realize that there were things that developed in you that can change. It's not permanent. Yes, it happened because of these circumstances, but those circumstances don't define who you are. You can find who you are in spite of the experience that you had. But at the same time, I don't see having cancer as a negative experience. I know that there's a purpose behind it. If I had led with, this was something that happened to me and I can't make sense of it, I would not be able to function. There has to be purpose inside of what happened. And I believe that I did walk away with a purpose. And I look for it every day. Lord, this is something that I am a Christian, so I'm going to say that. Lord, what is it that you're having me see today based on what I experienced? And what is it that you want me to do with that experience? And it's an open conversation with my family, with my kids, and it's something that needs to be discussed. It's those hard topics, the ones that we're talking about, those hard topics are something that need to become normal. And I love that Candid Conversations is doing that, because we need to be able to talk to people about not just, hey, did this affect you? Because that's really obvious that it did, but how are you doing inside of that? And what can I do to help you, to support you, to be there for you, and to create that tight-knit community that we all need.
Yeah, that's awesome. Thank you, Sarah. We've appreciated talking to you, and I've really enjoyed getting to hear your story a little bit more. I hope that our listeners have been encouraged by this, and if you do need that extra support, feel free to reach out. The number will be at the end of this podcast.
Thank you.
If you or someone you know needs someone to talk to, call Mayfield Counseling Centers at 719-452-4803.